The debilitating impact of blindness on anybody is grave and distressing, as it incapacitates an individual's competence while limiting the victim's productivity. Visual impairment or total blindness becomes even more pathetic if the victim is a young kid, because the prospect of educating him or her becomes a near impossible task. Apparently, the stigma and inhumane treatment of victims of blindness can sometimes be demeaning and can bring about low esteem of such individuals. The phenomenal rise in the rate of people suffering from various types of eye diseases that eventually cost them their eyesight has increased tremendously, as no fewer than 1 million Nigerians suffer from one form of blindness or the other. The president of the Ophthalmological Society of Nigeria, Professor Samson Omale, a professor of ophthalmology, speaks.
We had a national survey of blindness and visual impairment throughout Nigeria. And the results showed that 1 million Nigerians were blind, and 500,000 of this number are in immediate need of surgery to restore sight.
Alarmed by the increasing statistics on the proliferation of victims of blindness, the 40th Annual General Meeting and Scientific Conference of the Ophthalmological Society of Nigeria focused on the emerging trends and new challenges in the diagnosis and treatment of eye diseases.
We hope to use the opportunity of this year's conference to further go some steps higher in galvanizing fellow Nigerians and our friends elsewhere to work together to continue to advance eye care in Nigeria.
Research has shown that the eye care in Nigeria may not be effective or achieve the purpose of preservation and restoration of vision for people throughout the country because of seeming barriers.
Cost is a major barrier to eye care. A greater or a large percentage of Nigerians actually cannot afford eye care. Another barrier is the reduced availability of eye care services in some rural areas in this country, where a greater percentage of Nigerians reside. Another problem was ignorance amongst, or lack of awareness amongst some Nigerians about the ability of these problems to be prevented, or the fact that these problems can be prevented. And this is where partnership with the media is of paramount importance, because the media are the voice of the nation. They can advocate and enlighten people, about some of these problems.
Developing an alliance with the news media in order to gain platform to raise public awareness on the problem of visual disability, its magnitude, quality of life issues, and ongoing activity geared towards alleviating them. This requires that the leadership of our society signs a memorandum of understanding with the Nigerian Union of Journalists at the national level.
As part of a week of pre-conference activities, free eye screening was carried out in Rizek, a sub-rural community within the state capital of Jos, where over 1,000 inhabitants of the community, including about 200 staff of the National Center for Remote Sensing in Jos East Local Government Area of Plateau State, were tested and provided with glasses and drugs.
Because it's brought home to me, at my convenience, why wouldn't I, seize the opportunity of being a partaker?
A consultant ophthalmologist at the Jos University Teaching Hospital, JUTH, Dr. Obikili George, identified cataract and glaucoma as two major eye conditions that can lead to blindness if it is not discovered and treated early.
Particular eye problems, that especially the ones that we are screening for today, is usually old age related. That's cataract. That's the commonest cause of blindness in the world, including Nigeria. But fortunately, the blindness from cataract is reversible. So if you are blind from cataract and you are detected, as that's what we are doing now, you can be operated and your vision can be restored. The other one that is usually very dangerous is the glaucoma, which causes blindness irreversibly.
Cataract is a medical condition which presents with clouding of the eye's natural lens, which lies behind the iris and the pupil. When this happens, the lens becomes opaque and gradually loses vision as the cataract matures. Blindness attributed to cataract is reversible through surgical intervention, provided there are no coexisting eye conditions.
You are supposed to have yearly or 6-monthly examination of your body. That includes the eye. So you don't wait, just like your vehicle, you don't wait until your vehicle breaks down before you go to your mechanic. You go and service the vehicle. So for the body and for the eye, you're supposed to yearly at least see your eye doctor, get the eyes checked. If you have a pass mark, you thank God. If you don't have a pass mark, then you take it on from there.
Following the screening at Rizek, the society also carried out an outreach to Bokas local government area in Plateau State, where over 1,000 persons were seen and treated with medications. Glasses were provided or referred to the teaching hospital for further treatment, out of which over 100 cataract blind persons had their sight restored after cataract surgeries were carried out on them.
Before the conference proper, we usually have what we call a pre-congress activity, and one of which is the eye cam, which you can see going on here, provision of the free eye cam. We look for sponsorship, and this year we are lucky to have the government of Plateau State and Sight Savers International who have agreed to sponsor this eye cam to provide free eye services to the community here.
I have a slight impaired vision. Even though I'm bespectacled already, I figure it's no longer serving me the way it used to. So I believe it needed a review.
In fact, I'm very happy with what this organization has done to the community of Bokas local government as a whole.
The 40th Annual General Meeting and National Scientific Conference brought together practicing ophthalmologists and resident ophthalmologists in training from all over Nigeria to Jos, during which scientific sessions, lectures, speeches and exhibitions were held. At the formal opening of the conference, Chairman Local Organizing Committee Professor Caleb Mpiet said as a means of achieving universal eye care coverage, ophthalmologists must partner with various stakeholders to reduce blindness in the society.
The theme of the conference this year is building partnerships for eye care delivery, while the sub-theme is generating evidence for eye care. We have carefully selected this theme since we know that 80% of blindness is avoidable, and this is just through simple measures that do not need specialized care. There is therefore a need for us as ophthalmologists to think outside the box and partner with various sectors of the society if we are to achieve universal eye care coverage.
Let me appeal to you to come closer to the grassroots where many of our people suffering from eye diseases like cornea, glaucoma, cataracts and other related eye problems lack the means to visual rehabilitation, which is largely found in the urban cities.
In recognition of their tremendous contributions to eye care delivery in Nigeria, the society presented awards to the General Theophilus Danjuma Health and Development Support Program, HANDS, formerly known as Vision 2020 Support Program, and Carter Foundation.
And we wish that other NGOs will emulate your good activities. God bless you.
At the end of the conference, a communique read by the President of the Ophthalmological Society of Nigeria highlighted the fact that 42 out of every 1,000 Nigerians are blind, and that distribution varies from one geographical area of the country to the other, the commonest causes being cataract and glaucoma, with diabetic retinopathy becoming an evolving problem due to the increasing number of persons developing diabetes.
The likelihood of people coming down with diabetic-related eye disease is increased if we do not control it. The most important being diabetic retinopathy, where it's a condition where there's a lot of bleeding, collection of fluids at the back of the eye, to put it simply. And because of that, people are likely to have poor vision as a result of the fact that they have diabetes.
The good news, however, is that 80% of blindness is avoided through specialized care by eye care providers.
The equipping of hospitals is unevenly distributed because we have some private hospitals who have been able to acquire some of the sophisticated machines like laser machines, vitrectomy machines. These are all things that are used to provide specialized care to individuals with complications from eye diseases. But not all the hospitals, at least the public hospitals across Nigeria that offer eye care services, are fully equipped to handle these challenges.
This camera is 3.2 million naira, and government too can increase the allocation to health. If the budget for the health sector is increased, so the hospitals will be able to assist, acquire these equipments for the health of the people.
We must be able to find ways of being innovative. That's why we are looking at partnership to take care of eye problems. For professionals, of course, it helps us to think out of the box, to look beyond the clinic and see who are the other people that we can interact with.
The OSN was founded in 1969 with the sole purpose of promoting excellence in the practice of ophthalmology in Nigeria.
We have subspecializations, and in the practice of our profession generally, it's been very informative. When we come for meetings like this, we learn from each other because we all meet the same kind of problems, and sometimes because we're in isolated situations, we have problems. But when we come together like this and we have these very powerful presentations and papers, we get to know what our colleagues are facing, how they handle the same situation. So when we go back, we're better prepared to meet with the challenges. So it's always very important for us to come for these meetings. I think that's what we've really gained, and I don't think anybody's living here without feeling a sense of you didn't waste your money and you didn't waste your time.
Its annual general meeting normally provides a forum for the study and discussion of problems associated with the practice of ophthalmology, care for the blind, and the prevention of blindness in Nigeria, serving as an opportunity to deliberate on issues that will determine the direction of the OSN in the years to come.